My name is Dr. Alena Balasanova, and I grew up in Lincoln, Nebraska, where I spent my childhood. It was a great time. And I went on afterwards to Johns Hopkins University in Baltimore, Maryland, where I spent 4 years, and I studied Spanish and psychology, and I was also pre-med at that time. So I went on afterwards to Harvard Medical School in Boston, and that was a really great experience. And I stayed in Boston because I really liked it, and I went on to Boston Medical Center for my psychiatry residency, where is the only safety net hospital, only tertiary trauma center in the great New England region. So for a safety net hospital, that was a really neat experience. I've always really been interested in people's stories. Growing up in Lincoln, I felt like I was frequently asked about my story, and my family originally came to the United States when I was 7. So it was always so interesting for me to hear about where people come from and what they do and why they are the way they are. And that's really what drew me to medicine, because you really get to know people on a really intimate level. And I found that really important. As a general psychiatrist, I treat all psychiatric conditions or mental disorders in the DSM-5, the Diagnostic and Statistical Manual of Mental Disorders. However, based on the training and experiences that I've had, I have a particular interest in making sure that addictions are treated in the same evidence-based way that other psychiatric disorders are. So substance use disorders, which are so often, almost all the time, go along with psychiatric disorders. So including medication-assisted treatment for opioid and alcohol use disorders, any other treatment follow-up that might be necessary, and psychotherapy, I think, are all integral parts of the treatment that I provide. So when I first meet a patient, I really like to be more of a listener than a question asker, to be honest, because I think, again, going back to hearing people's stories, now is the time for the patient to tell me why they're here in my office. What is it that they're looking for? What is it that they want help with? What is it that they don't think they need help with? And in part, I think sometimes it's what they don't say that's more telling. And paying attention to all those little nuances, particularly in psychiatry, is really important. It's something I take notice of. I think academia right now is the most exciting and stimulating time. I think innovation in our field, in all medical fields, is what's driving the science of tomorrow. I think it really directly translates to patient care, especially somewhere here like Nebraska medicine, where we're at the forefront of all discovery in pretty much all medical fields. So I think for patients, it's a really ideal opportunity to get to meet and interact with and get treated by the best clinicians, the most, participate in the most evidence-based practices, and get the best care.